Welcome to the YouTube channel. In this video we are going to see some important questions and answers related to prometric nurse interview and exams. If you're new to the channel, please subscribe to get more related videos.
Question number 1. During a vaginal delivery of woman 38 years old, the nurse should consider the risk of which of the following? Options are A. Acute bleeding and coma. B. Low potassium. C. Brain injury. D. Fetal heart rate. The correct answer is option D. Fetal heart rate. Question number 2. Lochia red sometimes happens during postpartum to bleed heavily with smell for the first 3 to 10 postpartum days. The nurse should expect that may too. Options are A. Lochia pink. B. Sign of abnormal hemoglobin. C. Infection. D. Bleeding. The correct answer is option A. Lochia pink. Question number 3. A head nurse of a coronary care unit delegated the staff a senior nurse in that unit. What initial step must the head nurse implement before? Options are A. Check the hospital policies for delegating tasks. B. Explain the task to the senior nurse. C. Negotiate with the senior nurse. D. Take the signature of the senior nurse. The correct answer is option A. Check the hospital policies for delegating tasks. Question number 4. A health female, her period every 28 days and doing now diet the period or menstruate has stopped since 5 months. The nurse should expect which of the following? Options are A. Secondary amenorrhea. B. Primary amenorrhea. C. Cancer. D. HIV. The correct answer is option A. Secondary amenorrhea. Question number 5. A new infant has born and his mother is confused if the infant may have gestational diabetes as she had it during her pregnancy. Which of the following the mother is the consider of her baby? Options are A. Hypoglycemia. B. Anemia. C. Hyperglycemia. D. Infection. The correct answer is option A. Hypoglycemia. Question number 6. Which is the priority for a child who has returned to the unit after surgery to repair a cleft palate and lip? Options are A. Interacting with others. B. Managing pain. C. Preventing infection. D. Ambulating every hour. The correct answer is option B. Managing pain. Question number 7. What precautions are necessary when caring for a patient with hepatitis A? Options are A. Gowning before entering the room. B. Wearing gloves for direct care. C. Wearing a mask at all times. D. Placing the patient in a private room. The correct answer is option B. Wearing gloves for direct care. Question number 8. When a patient is admitted with acute influenza, what type of isolation is most appropriate? Options are A. Reverse isolation. B. Contact isolation. C. Strict isolation. D. Respiratory isolation. The correct answer is option D. Respiratory isolation. Question number 9. While caring for a patient in the post-anesthesia care unit, PACU, a nurse plans to keep the patient warm. What is the most important reason for this action? Options are A. To preserve nutritional stores. B. To prevent cutaneous vessel dilation. C. To decrease patient anxiety. D. To lower risk of infection resulting from chill. The correct answer is option D. To lower risk of infection resulting from chill. Question number 10. When using a fire extinguisher, the hose is aimed at the options are A. Area around the flame, B. Base of the flame, C. Middle of the flame, D. Top of the flame. The correct answer is option B. Base of the flame. Question number 11. Which of the following is the first step for inhaler technique education in patients with asthma? Options are A. Breathe out gently, B. Place mouthpiece between lips, C. Shake the inhaler, D. Wait a few seconds then repeat the above process. The correct answer is option C. Shake the inhaler. Question number 12. Which of the following uses for abdominal examination? Options are A. Percussion, inspection, auscultation, palpation, B. Auscultation, percussion, palpation, inspection, C. Inspection, auscultation, percussion, palpation, D. Inspection, palpation, auscultation, percussion. The correct answer is option C. Inspection, auscultation, percussion, palpation. Question number 13. A nurse manager is sharing decision with the staff. This can be described as which of the following? Options are A. Democratic, B. Decision making, C. Judgment, D. Not all of above. The correct answer is option A. Democratic. Question number 14. A patient is transferred to the post-anesthesia care unit, PACU, after surgery with epidural anesthesia. After taking the patient's vital signs, what should the nurse assess next? Options are A. Spinal headache, B. Postoperative pain, C. Bladder distension, D. Ability to move legs. The correct answer is option D. Ability to move legs. Question number 15. When making shift assignments, which patient is most appropriate for a nursing assistant? Options are A. A newly admitted patient with a seizure disorder, B. A post-hysterectomy patient who needs to ambulate, C. A dehydrated patient with an electrolyte imbalance, D. A post-op laparotomy patient who needs education. The correct answer is option B. A post-hysterectomy patient who needs to ambulate. Question number 16. Your home health client has been throwing up for several days. You now find her lying in her bed. She is pale, lethargic, and her eyes are dull. She is also anxious. Which of the following is most likely? Options are A. Congestive heart failure, B. Multiple sclerosis, C. Fecal impaction, D. Hypovolemic shock. The correct answer is option D. Hypovolemic shock. Question number 17. Lochia red sometimes happens during postpartum to bleed heavily with smell for the first 3 to 10 postpartum days. The nurse should expect that may too. Options are A. Lochia pink, B. Sign of abnormal hemoglobin, C. Infection, D. Bleeding. The correct answer is option A. Lochia pink. Question number 18. A head nurse of a coronary care unit delegated the staff a senior nurse in that unit. What initial step must the head nurse implement before? Options are A. Check the hospital policies for delegating tasks, B. Explain the task to the senior nurse, C. Negotiate with the senior nurse, D. Take the signature of the senior nurse. The correct answer is option A. Check the hospital policies for delegating tasks. Question number 19. A disability patient already on the wheelchair has visited by her nephew. Her nephew responds to the patient that she has done something wrong and that God punished her and become in this condition. Which of the following describing her nephew behavior? Options are A. Moral, B. Anger, C. Abuse. The correct answer is option C. Abuse. Question number 20. A health female her period every 28 days and doing now diet the period or menstruate has stopped since 5 months. The nurse should expect which of the following? Options are A. Secondary amenorrhea, B. Primary amenorrhea, C. Cancer, D. HIV. The correct answer is option A. Secondary amenorrhea. Question number 21. The American Academy of Pediatrics suggests that removal of the tonsils under certain conditions. Which of the following meets these conditions? Options are A. Times viral tonsillitis per year, B. Infrequent snoring and nasal quality, C. 3 times bacterial tonsillitis per year, D. Tonsillitis accompanied by adenoid inflammation. The correct answer is option C. 3 times bacterial tonsillitis per year. Question number 22. Multiparous patient on day 1 postpartum is asking the nurse to send her baby to the nursery so she can sleep. What is the most likely phase of psychological adaptation? Options are A. Taking in, B. Letting go, C. Taking go, D. Letting in. The correct answer is option A. Taking in. Question number 23. A pregnant client with organ dysfunction presents with visual changes, 3+ deep tendon reflexes and a severe headache. At a subsequent follow-up visit the client reports that the symptoms have resolved. What is the most likely reason for the improvement? Options are A. Sleeping in a lateral position, B. Consumption of 8 ounces of water per day, C. Exposure to bright lighting, D. Ambulation every 30 minutes. The correct answer is option B. Consumption of 8 ounces of water per day. Question number 24. During cardiopulmonary resuscitation, CPR, for a 75-year-old man in the emergency department, the doctor introduced himself as a leader for the CPR. What is the most appropriate leadership style for this situation? Options are A. Autocratic, B. Democratic, C. Bureaucratic, D. Laissez-faire. The correct answer is option A. Autocratic. Question number 25. Mr. A. admitted to CCU with the congestive heart disease. His vital signs are hour 120 beat per meter, BP 110/60ths mmHg. Stroke volume is 80. The cardiac output for Mr. A is. Options are A. 182, B. 1700, C. 2400, D. 9600. The correct answer is option D. 9600. Question number 26. 19-year-old girl was scheduled for the extraction under general anesthesia. Her preoperative was done and the consent was signed by her. But her nail polish and trim her long nails requirement. What should be the nurse's action in response to? Options are A. Explain why nails need to be cleaned, B. Respect the patient's right to refuse, C. Record and inform physician, D. Remove as per protocol. The correct answer is option A. Explain why nails need to be cleaned. Question number 27. During the home visit by the community health nurse, she observes that the infant baby during breastfeeding stops sucking and the milk is leaked from the nose. What would the nurse suspect? Options are A. Pyloric stenosis, B. Tracheoesophageal fistula, TEF, C. Cleft lip, D. Cleft palate. The correct answer is option D. Cleft palate. Question number 28. A woman is admitted to the hospital with ruptured ectopic pregnancy. A laparotomy is scheduled preoperative. Which one of the following goals is most important for the nurse to include on the client plan of care? Options are A. Fluid replacement, B. Pain relief, C. Emotional support, D. Respiratory therapy. The correct answer is option B. Pain relief. Question number 29. A laboring woman desires to participate in her cesarean and have pain control. Which of the following methods would satisfy the woman's needs? Options are A. Epidural block, B. Pudendal block, C. Meperidine injection, D. General anesthesia. The correct answer is option A. Epidural block. Question number 30. A patient is admitted to the unit with an order for seizure precautions. Which action is most appropriate? Options are A. Move the client to a room closer to the nurse's station, B. Serve the client's food in paper and plastic containers, C. Maintain the client's bed in the lowest position, D. Ensure that soft limb restraints are applied to upper extremities. The correct answer is option C. Maintain the client's bed in the lowest position.